Well, today we're going to talk about Palo Alto measures E and F. We're in the thick of the election season, and we should go over what these measures mean so Palo Alto voters are informed come November 6th or earlier if they're going to do mail-in ballots. Measure E, hotel tax hike. Measure F, healthcare initiative. Janani, let's start with E. So the hotel tax hike, obviously there's people for and against. The ones against, the hoteliers, you've met with some of them. Let's just talk about what the tax would be and why they're opposing it.
Yeah. Well, of the two measures on the ballot, E is infinitely simpler than F, and Palo Alto has been through this before several times in 2007, 2000, and in 2014, which was the last time they raised the transient occupancy tax, also known as the hotel tax. And from the council's perspective, this tax increase is needed because construction costs have gone up so high and they needed to pay for the infrastructure. But the hotel people, they pretty much oppose it for the reasons I just mentioned, because Palo Alto has done it so many times, and at this point, the city's rate is pretty much near the top, and it would be the highest if this thing passes.
In the state.
In the state, yeah. And this is an issue that's been kind of debated, and I think when the city council introduced what was to become Measure E, they made a point of not wanting to be the highest. Greg Scharf pointed to Healdsburg, which has 16%, which he said has 16% rate, which isn't entirely true. It has 14% and 2%, which goes back to the hotel industry for like marketing and whatever. So yeah, hotel people don't want Palo Alto to be number one in highest tax rate. They think it's going to drive off customers, particularly corporate clients, and they vociferously oppose this measure.
Yeah, so the measure would go from, the TOT would go from 14%, which currently is, to 15.5.
Correct, yeah.
And that would estimated to be bringing in about $2.5 million?
Yeah, $2.55 million is their estimation in the next year. But again, this kind of depends on a lot of things, including new hotels and vacancy rates and things like that. But yeah, the city estimates about $2.5 million a year, which is, and currently the city gets about $25 million from all the hotel taxes every year.
This has been pretty lucrative for the city in the past. I think the hotel taxes were like at $12 million.
Yeah, just in the past decade or so,
yeah.
it's pretty much doubled. And not just because of the rate, but also because new hotels have been coming online, and new ones are also expected to come online. The two Marriotts in San Antonio that have applied, and so yeah, it's the city sees this as a cash cow, and most importantly, they evaluated different taxes, and surprise, surprise, voters are much more likely to vote for something that other people pay, which in this case, hotel guests.
Yeah, the city actually polled residents and asked them what they thought about a parcel tax and a sales tax and a hotel tax, and
it comes down to, would you like to pay a tax or would you like other people to pay it? It's not a very hard decision.
I saw there was some criticism about the ballot language. The city isn't very specific on that.
Oh, yes.
Why is that? Can they change it? Do they have time to change the ballot language if they wanted to? Or
at this point, the language is already set.
Okay.
The deadline was in August. But yeah, the language in the ballot is very vague. It's when you consider the council's argument for this tax, both in 2014 and right now, is to pay for the infrastructure plan. The whole argument is we need to keep our promise to the voters when we pass the last one to fund these 9 projects, which includes the public safety building, 2 garages, 2 fire stations, bike bridge over 101, a few other improvements. And basically, yeah, the bike boulevards. And basically, so this is supposed to be the continuation because the costs have gone up. But if you look at the ballot language to your question, it says very little about these particular projects. Instead, it has language that's been pretty much poll tested and based on what the council and the pollsters believe will appeal to voters the most. So it reads, to provide funding for vital city services such as ensuring modern, stable 911 emergency communications, earthquake-safe fire stations and emergency command center, improving pedestrian and bicycle safety, ensuring safe routes to school, maintaining city streets and sidewalks, which, by the way, is not an infrastructure plan at all, and other city services should the city adopt this tax. So it's kind of vague. There is a nexus because public safety building is the top priority, so these things are a part of it, but it doesn't explicitly say to build new police headquarters, to replace 2 fire stations. It kind of talks about the kind of things the general fund gets spent for, and includes things like streets and sidewalks, which is not
Which
part of the
aren't part of
infrastructure
the
plan.
infrastructure plan, yeah.
And I think the arguments for the measure, which are supported by the city, make kind of the same kind of vague allusions to what the money could be spent for. But the fact remains, it's just going to be going to the general fund, and the council could spend it on anything they want to legally. So
There's at least one council member who was very adamant about this not being sufficient.
Right.
Greg Tanaka,
right, yeah, and he time and time again brought this up and said, if we're going to send this to the voters, let's tell them specifically what it's for. I think the mayor said this would be awkward to spell out.
Spell out 9 projects.
Yeah. I don't know what that means, what would be so awkward about it, but yeah, the rest of the council kind of just decided to go with this language.
So is there some concern that this would not be binding then? I mean, that the money would be able to be spent on something other than the projects that were spelled out in the 2014 infrastructure plan?
For those who oppose Measure E, absolutely there's concern, but I don't think the council is too concerned about having more discretion about what to do with the money. I mean, if they want to, they could legally spend it all on salaries and benefits and anything else they want to. They're saying they won't, and in the past they have used hotel taxes for infrastructure, and I have no reason to think that this is what they do, that they would use this money for a completely different purpose. But there's nothing in the law or the language that would keep them from doing so. So
Okay.
that safeguard doesn't exist because this is a 50% to vote tax. It needs a simple majority, and as such, it's not binding for any project.
So there have been a couple other infrastructure projects that have come up since 2014 that the city's dealing with. One is the renovation of the Junior Museum and Zoo, and then also the animal shelter. So could those be funded under this?
Yeah, anything
Anything can be.
Anything can at all, yeah.
Okay.
And also the park site near Bulwer Park. In fact, when the council was debating whether to raise it to 16%, which was their initial intent, or 15.5, which what they amended it to after a late night negotiation, which got very political and very kind of old school kind of dealing. The council members kept saying, we want to fund more community services. Animal shelter was brought up. It's like they were almost like 15.5. No, we want the park as well. So the list, the 2014 infrastructure project list remains fixed. Is the same 9 projects that were adopted then. But the council's priorities are always changing. There's things being added onto the list. So it wouldn't surprise me if some of this money was used for the animal shelter, which may be what the community and the council wants, but it's certainly not clear in the ballot language or in any of the analyses in support of Measure E.
So I'm interested in talking about vacancies because that's one of the reasons why the hoteliers say that this could harm their business. The hotel vacancies have increased over the last couple of years. There's no direct correlation that's been established between raising the hotel tax in 2014 versus the vacancy rate, right? I mean, it could be a number of different factors.
Right, and the vacancy rate, to be clear, remains pretty strong. It's about 77% occupied. So it gone down like a smidge since like in last year, but it's been like in the high 70s throughout. But what the hotel people would tell you that when the city raised it in 2014, it wasn't the highest in the state. This time it would be, and this could turn off a lot of like corporate clients who could easily go to Mountain View or Menlo Park. Like the pro Measure E argument basically says this is going to add the price of a cup of coffee to a $250 bill, just a couple of bucks. But the hotel people totally reject that because they see most of their visitors to the hotels as not one person coming in and paying a bill. They're thinking about huge corporate clients with hundreds of rooms being rented and a travel manager making these decisions. So they're almost insulted by this cup of coffee argument when it's one person making a decision for like 1,000 rooms. They could easily switch from.
So the cup will add up to a carafe, which will add up to like gigantic,
exactly.
swimming pools full of coffee.
Yeah, and they're afraid that whoever manages to travel for whatever corporations visiting Stanford or the research park companies will just look at Palo Alto's tax rate. It was 15.5% of this passes. Consider the fact that the state's median average is like 10%, and they can go to Menlo Park, which has that rate, or to Mountain View, which has 12%. So that's their fear of the people who oppose Measure E.
Okay.
In Healdsburg, that's where it's 16, well, 14%. Have there been any studies to show there's been a negative impact since they've raised the tax, or?
I'm not exactly sure, and I know that they have something called the Healdsburg Tourism Improvement District, and I assume if this was hugely detrimental, they would probably do something about it. But Healdsburg, as the hotel people would tell you in Palo Alto, is a tourist place that people like to visit. It. And Palo Alto isn't so much. And Anaheim is a tourist place. They have 15%, which is the highest. They have Mickey and Goofy and Donald, so you have families coming in. They might be susceptible to the coffee cup argument. But unlike Healdsburg here, it's a corporate town. So even if it didn't have, to your question, even if there wasn't such effect in Healdsburg, that doesn't mean that there wouldn't be such effect in Palo Alto, just because of the difference in the customer base.
I'm kind of curious what the vacancy rates are in Mountain View and Menlo Park. Has the city studied that at all?
I'm not sure they have.
Okay. Also, there's another idea that was thrown out by a hotel exec, which was, hey, why doesn't the city start collecting on the Airbnb rentals? And that's interesting for two reasons. One is because Airbnbs have to, in order to be legal, they have to be renting for more than 30 days. So the hotel exec suggested that there was like $5 million.
Yeah, there's like $5 million on the table, and this is, I haven't verified these calculations. I think he was just looking at all the listings and how much they charge.
Yeah.
This is John Hutar from Dinah's Garden Hotel.
Okay.
And he told the council at one point, you're leaving like $4 million on the table out of the 5 that you could collect, so why don't you go that route instead of raising $2.5 million by getting the highest rate. But I think the council hasn't really been aggressive about the Airbnb issue.
Right,
whether,
they haven't.
Whether
Yeah.
for lack of staff work or it just hasn't been a priority, so I think it would be a much more complex endeavor than basically hitting all the hotels where you know where
The
they
known
are.
hotels.
Yeah. So
Yeah.
this seems to be the easiest path to getting the money.
Yeah, I was questioning whether or not the $5 million was for Airbnbs that are legal, so 30-day stays or more, or if they're for all the ones that are out there.
Oh, that's a good question. It's worth following up on.
Yeah. Okay. Let's turn our attention to now the more complex initiative, which is Palo Alto Accountable and Affordable Healthcare Initiative, which was brought by SEIU, United Health Workers, the union that has workers at Stanford and other medical places. So they're trying to cap the cost that medical providers charge to 115% of reasonable costs. Is that correct?
Yeah. So basically, if this passes, the medical provider could make 15% profit, but not more than that, by the definition.
And one of the sticking points is that the entity regulating this would be the city. And the city hasn't done this before.
They haven't.
Yeah.
The city's
The city doesn't
struggling
want
really,
to.
really hard to put together a business registry right now, and it's failing miserably in keeping a list of how many businesses are in the city.
Right.
They don't want to become the regulator of healthcare and audit every medical procedure that takes place at Stanford Hospital, PAMF, and the dozens, however many
Dentists too?
however many other medical providers in Palo Alto.
Yeah.
Yeah.
Auditing to see if they're reasonable, that's an interesting burden for the city to bear.
Yeah, that would. I mean, I think the city thinks is going to be extremely onerous, very expensive, so complicated they don't even have an estimate for how much it's going to cost or how many people to hire. We have some idea because Livermore's got the same kind of initiative on the table, and they have done a commission analysis. So
Yeah.
but
Good thing that they did. So how much did they estimate?
about $750,000 startup cost, and then about $2 million a year. And you have to hire like a new health director, like a 3-member management analyst team. There's like a bunch of positions that you have to create.
Yeah.
So it would be they think it'll be about $2 million a year. And again, it might be apples and oranges. I'm not sure if how many medical facilities Livermore has versus Palo Alto, but since we are talking about analyzing reports and kind of managing a program of this sort, I assume it would be somewhere in the same ballpark.
Yeah. Let's look at what reasonable costs include. So,
Let's. It includes, well, I guess the biggest category is salaries and wages and benefits of non-managerial hospital, medical clinic, or other provider staff, so non-managers. So the person directly treating the patient would be covered. Their supervisor wouldn't be. The manager wouldn't be. The CEO wouldn't be. Anyone outside the direct.
Legal staff wouldn't be.
Exactly. Let's see. Staff training and development would be covered. Pharmaceuticals and supplies would be covered. Facility costs and laboratory testing and depreciation and amortization of buildings, leasehold improvements, patent supplies, equipment.
Okay, so there is some overhead included.
A little bit, yeah, but a lot it wouldn't be covered. Like most importantly, like the administrative costs,
Yes.
which every hospital has to have. They'll tell you.
Yeah, those are sometimes are the people who are paid the most. So.
Right. And I think the opponents of Measure F, Dwayne Downer, who was like the head of the California Hospital Association for 32 years, recently retired, and he's now the special advisor to those opposing the measure. He estimates that the ones that aren't covered constitute about 4% of a hospital's total cost, just to
Okay.
give a sense of like the proportion.
Okay. Yeah, so reimbursements, I guess the healthcare providers say that 150% of the paying private payers is one thing, but they have a lot of patients who don't, whose reimbursements, whether through Medicare, Medi-Cal, military, those reimbursements don't nearly cover the costs. So they'll really be eating a lot of expenses.
Right. Yeah, the argument is that this is Stanford Healthcare, for example. They do overcharge patients as a policy, like private payers, because they need the extra money to subsidize the cost of those, like Medicare patients, Medi-Cal patients, for whom the hospital only gets reimbursed at 90% and 70% respectively. There's also people who are uninsured, TRICARE veterans, whose proportion, who pay like even less. So, you know, if you chip away at the roughly 150% that they charge and bring it down to 115, the hospital still can't charge the other categories more, so they'd have to reduce costs in other ways, which would be detrimental, they say, to the patients, and would ultimately, ironically, hurt the union because there'd be less money for wages and benefits and all the other stuff that the union wants. So
let's talk about an interesting nexus. Healthcare costs and the cap on that, and infections in hospitals, because the union has been saying that this is about patient care and it's about trying to reduce those infection rates. I don't quite understand how capping the costs relates to better attention to hospital infection rates. Is that one of those questions that's still out there? Or?
it's a good question. I mean, I think the union's position would be that Stanford is spending too much money on stuff that doesn't relate to direct patient costs, and this would force them to focus their expenses to actual patients and making sure the infections rate are lowered. There's been a problem with C. diff, the bacteria infection that they've been highlighting for like 2 years back when they were negotiating. And so the idea is that by creating this cap, Stanford will be more focused on spending money on the kind of things that would reduce the infection rates. But,
so that's part of the patient care.
But my biggest problem with that, though, is what about all the non-Stanfords, which is like everyone else is being covered. Like, you know, if you're pursuing this because of the C. diff infection at Stanford, then like,
yeah, why is everyone else caught up?
The dentist is going to be cut up in the bureaucracy, or your local optometrist is going to be cut up in the same exact bureaucracy.
Sure.
So it's quite a wide net for that specific problem, significant as that problem may be.
Yeah, and some individual practitioners have come to the council to speak up?
They have. They've been threatening that, well, not threatening, they've been saying that this is probably going to force us to go Mountain View or whatever, Menlo Park, because why would we want to subject ourselves to this new bureaucracy and have an audit every year of every patient we do, and then have it go to the city and, you know, go through the whole refund process, ask for exceptions if needed, when you could just move a mile or two and not have any of that.
Yeah.
So.
One of the wild cards, it seems to me, is the litigation that could ensue. So if Stanford were to disagree with the city's assessment of what a reasonable cost is, then I guess Stanford could sue, anyone could sue. And how are those costs borne? Those aren't really covered in the...
That's not direct patient care, no.
Right, yeah.
Well, first of all, Stanford doesn't have to sue immediately. The initiative does allow medical organizations to petition for exceptions. You know, there might be cases where they need to charge more, and if they make the case and they get an exception, you could just go that route. But you know, when I mentioned that to Dwayne Downer of the California Hospital Association, he basically said that's fine for like a, you know, if you need a one-time kind of fix, but less so if you're talking about these wholesale expenses that are always out there, like technology and, you know, and administration and supervisors, that kind of stuff. So that appeal process doesn't really cut it. Stanford could, I suppose, sue the city at that point, but the irony here is that the city is with Stanford in opposing this. Like the council took a stance against it. So I think the bigger likelihood is that there's going to be an initiative, like a lawsuit against the initiative, against
If
the
it were to
SCAU,
pass.
if it were to pass. And that I would fully expect to happen if this does pass, just based on how much litigation has already happened and how much has been threatened.
Right. They already tried. Stanford already tried that
Right.
to stop this initiative.
Stanford Hospital, PAMP, and a few others, they grouped together to file a legal challenge. And they did not succeed, but the judge's ruling to basically let this proceed to the ballot was fairly narrow. He did not feel that this preemption argument, which is basically federal and state governments ready to take care of it, they don't feel that was really that valid. But they did agree that the argument raises some issues about vagueness and other things. But the better way to handle it is to let it go on the ballot and then hash it out in court after that. There's a really, really high bar for a judge to kind of take an initiative that people voted to get on the ballot and basically say, no, it's not going to go. It's feels almost undemocratic, you know. But so he said, let's revisit these issues if this passes, and if it doesn't pass, these issues are moot point.
Okay.
So, in one hand, it's a victory for SEAU UHW, but it's a limited victory, and it does suggest that there's more to come on the litigation front if this passes.
Okay. I'm seeing a lot of advertising on YouTube from Stanford Healthcare. I'm kind of curious what the climate is right now that you're seeing for proponents and opponents trying to get the word out. Are there lawn signs and all that, or?
Yeah, I mean, I've seen ads from both camps. There's one in Livermore. It's called Measure U out there, and it's the same kind of argument they've been making in Palo Alto. It's about the high cost of Stanford, like childbirth here. They're saying it's cost 7 times more that at California Pacific Medical Center. So they have like 4 different procedures that they say Stanford charges much more for them. And they're talking about the infection rate. So it's the same kind of argument we've heard when they've been speaking.
Okay.
Stanford Health is, but I haven't seen too many boots on the ground from the SEAU at this point. There was a June 11th meeting where there were quite a few grad students, people for whom Stanford is the only provider. They're insured with Stanford, and they complain about kind of substandard care. Since then, though, I haven't really seen anybody at City Hall speaking on behalf of the measure. There was one person actually who's part of like the Social Democrats of America who said that he supports it, but almost everyone else was speaking against it, like the doctors and nurses. So I feel like the opponents have been more visible, at least like at City Hall, but I haven't been diligently tracking YouTube, so I'll have to take your word on that.
I'll let you know if there's a proponent YouTube video.
And the NONF side has also released a bunch of flyers and basically refuting a lot of the arguments. The NONF kind of indicated what the cost would be if this was implemented, and the idea that the revenues would plummet by 11% if this passes, whereas right now there's a 3% profit margin, Yeah, I've seen flyers, but I haven't been watching too much TV and following the ads in that sense.
All right. There's one point that I did want to bring up because I thought this was interesting. So the cap is 115%, but that's of cost. It's not like a fixed dollar amount. So theoretically, Stanford could invest more in the patient care. The cost would go up, and they would be able to charge 150% of the higher cost.
Precisely.
As well.
Yeah. And this is what I think one of the most kind of striking things about this measure. I mean, if you read the for Measure E argument, it would say that this will ensure that the cost will be held steady,
Measure F.
lower. Sorry, Measure F. Measure F, yes. It says it will ultimately result in lower overall healthcare costs, which could be true, but it doesn't necessarily have to be, because as you said, if we're talking about 115% of direct costs, and if that amount goes way up, then even capping at 115 will leave the patient with a higher bill. I mean, it probably would make sure that more costs are targeted towards direct patient health, but does it really ensure with an E that that's what would happen?
Has anything similar to this measure passed anywhere else in the state?
I don't think it has.
Okay.
No, I know SEAU has tried different measures. So SEAU UHW has had different measures that did pass in the state. It wasn't anything like this. I mean, Livermore is happening right now, and they've tried to do it in other cities like Emeryville, where their effort was preempted by the city's court challenge, and there were, I think Redwood City, they also tried to. Basically, every city that has Stanford, they tried to do that, and right now Livermore and Palo Alto are the only ones. But they have tried to do other things. Like 6 years ago, they passed a measure that capped the pay of CEO at El Camino Hospital, and I was talking to Dwayne Downer about it, and he basically characterized that as a negotiation tactic, like
okay.
that kind of thing. He said that they've tried to do statewide measures 3 times, but they never got on the ballot. And that measure to cap the pay, SCAU actually stopped pursuing it after a while because they reached a deal, but it was too late to withdraw it. And so it ended up on the ballot, and voters actually approved it by like 51.9% to like 48.
Ooh, squeaker.
So it was a squeaker, and then the court ultimately tossed it out because they decided that it violates contracts, so it was null and void. So opponents of Measure F will tell you this is something that the SAU UHW does all the time. It's to pressure Stanford to let it organize. It's because they want to get more workers to join the union, and to them this is just another example. And the SCAU UHW would tell you nothing in this language has to do with organizing. We're not organizing right now.
Our contract
It's a
is
moot
already
point.
negotiated right now.
We have
Yeah.
a 3-year contract that we had in December, so
Yeah. If readers want to bone up on these issues, last week's cover story was on Measure E. Today's cover story is on Measure F. They can pick up the copies on the stands or in their homes, or go to paloaltoonline.com. Thanks so much for the discussion today.
thank you.
You can also follow us on Facebook, Instagram, and Twitter, or if you like these videos and you want to be notified of them, hit subscribe below. We'll see you next week.